So now I will highlight the complications associated with ankylosing spondylitis, and then I will highlight how to investigate this patient. So they can ask you what is the most common complication in ankylosing spondylitis. So it is most likely anterior uveitis. It is commonest one. It occurs in 30% of the cases. Okay, and whenever you have to remember the complication of ankylosing spondylitis, you have to focus from head to toe. Okay, then anterior uveitis, then you have to ask any neck problem at lung to axial subluxation is another complication. Then aortic regurgitation is occurring only in 4% of the cases, while active ventricular block is occurring up to 10% of the cases. Other cardiac complication includes aortitis. So don't remember only aortic regurgitation. There are other complications also, cardiac complication in ankylosing spondylitis, like atrioventricular block and aortitis. Okay, in the lungs, what could be the manifestation? It could be apical fibrosis, apical pulmonary fibrosis, but in the lungs, because of the restriction of the rib cage, if the patient is having a scoliosis or kyphoscoliosis, it will restrict the chest movement. Although the auscultation chest will be normal, but patient will be having dyspnea on exertion. And if you will do the spirometry, it will show you restrictive pattern of spirometry, restrictive pattern. So other complication from eyes, we can see anemia also. Okay, then we will go down to abdomen. In abdomen, we have to see amyloidosis is there or no. We asked already about the frothiness of the urine. Then we can ask about loose motions. We can ask, and we can search for hepatosplenomegaly. Down, we can see like Achilles tendonitis. So these are the common complications that we should consider in a case of ankylosing spondylitis. Now I'm moving towards the how to investigate. So the investigation, you will classify like the baseline investigation and then the specific investigation. The baseline
Sir, there is
investigation.
a problem with the voice, sir. Would you kindly be a little bit loud, sir, please?
Okay, is it clear now?
No, sir.
Other audience, can you listen to me clearly or no?
It's clear.
Okay, Dr. Sai, I think it is from your side. You can listen to YouTube channel also tomorrow.
Sure, sir. Sure.
So,
thank you.
Welcome. So we can divide the investigation into baseline investigation that will include the complete blood cell count, ESR, CRP, kidney function test, and liver function test, and RA factor. Here we have to do RA factor to prove that this is seronegative arthritis. Okay, and then HLA-B27. HLA-B27 is positive in 90% of the cases of ankylosing spondylitis. Then there are radiological tests or imaging that we can do, like the X-ray of sacroiliac joint and spine that will show features of sacroiliitis. We can do chest X-ray. It will show us the findings of apical fibrosis. It can show the findings. Then the more specific test for joint abnormality is MRI. If X-ray is not helpful, especially in the early stage of the disease, MRI will show active erosions, inflammation will be positive, and X-ray findings, whatever the X-ray findings is not clear, here you can see the findings here. Okay, there is another finding that used to say bamboo spine in which there is fusion of the vertebral bodies. It's a radiographic feature seen in ankylosing spondylitis. It occurs due to vertebral body fusion by marginal syndesmophytes. So these are the tests that we can do. Then the test is specific for complications. So in case of chest complication, we will do chest X-ray, high resolution CT scan for apical fibrosis, and X-ray can be PA view and lateral view. Lateral view will give us more idea about kyphosis and kyphoscoliosis. And it will be confirmed by also high resolution CT scan if you're doing, and then spirometry. In apical fibrosis and in a restrictive pattern because of the rib cage abnormalities, it will show restrictive lung disease. In cardiovascular system, we will do ECG to find out any block is there or no, atrioventricular block is there or no. And we will do the echocardiography to find out the patient is having aortic regurgitation or no. Sometimes we need to do X-ray of cervical spine. As we told, there is complication known as atlantoaxial subluxation. And sometimes we may do MRI of cervical spine also to find out this, because this is serious complication. Atlantoaxial subluxation is a serious complication. Patient can die because of this. So these are most of the investigation that I covered. Now I'm moving towards the management of this patient. So management of ankylosing spondylitis, we will divide into non-pharmacological management. Then pharmacological management, we will divide into medical and surgical management. So non-pharmacological management, you will explain to the patient that we will make this multidisciplinary team in which we will involve different specialists, doctors and the nurses. So, and we will offer the patient physiotherapy and occupational therapy. We have to stop smoking if he is having a smoking history. We will ask him to stop alcohol because he will take the medicine that will affect the liver functions. So we will urge him better you should stop your alcohol intake, because we have to give some specific treatment at some time in your management. So better you should stop alcohol. Stop driving if there is restriction of the neck movement, and stop driving if there is visual problem. Otherwise, patient can continue driving. If there is neck restriction, then patient can have, by the occupational therapist, they can arrange one special type of mirror that is placed in his car. So if it is a special type of mirror, bigger type of mirror, and it is placed on a special sides, so he can see to the back winds of the car, and he can drive. So it will be assessed by the occupational therapist. So they will provide a special form of mirror. If it is arranged, then if it is safe, he can drive. Otherwise, he will stop driving. Right. So to address the concern of driving, we have to first establish whether it is problematic for him or risky for him or no. If it is not risky, he can continue driving. Okay, we have to inform the patient you have to be active. You have to do physiotherapy, and best form of exercise for him is swimming. We will start with the simple painkiller. If it is not responding, we will go to the tumor necrotic factor alpha inhibitors. That includes the adalimumab, etanercept, and infliximab. Okay, then the last option is surgical treatment. Sometimes when the medical treatment is not giving relief to the patient.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.